At Milton Keynes Hospital, a fifth of the budget for nurses goes on agency staff, temporary workers who fill vacant shifts, usually for higher pay. All hospital trusts in England have been given a target to sharply reduce these agency costs, a target they must achieve by the end of the financial year in March.
We're making good progress, but the key challenges for us are around the pace of change. So getting all of this in place by the end of the year is very difficult. We obviously can't train new doctors or nurses in 6 months.
It was last summer the Health Secretary announced this clampdown on what he called rip-off agencies. Each trust now has a maximum they can spend on agency nurses. But when we asked hospitals about their performance, 47% of those that responded failed to meet their target during October, the first month of the new regime.
Many organisations do break the cap, then indeed there'll be a point about the credibility of the system. And many other organisations may find also then that what's the point of staying within it, particularly if it hurts their performance and they feel that patients might be losing out.
For now, it seems trust bosses prefer to break the rules rather than risk leaving shifts unfilled.
Where we have to break the ceiling in order to protect patient safety, we will. And we will make judgment calls every day to ensure that our patients are safe and that we're using our money efficiently.
Amy left the NHS to become an agency nurse a year ago.
The shift pattern in the NHS is different every week, so I couldn't find childcare that was different every week.
New rules also cap how much she earns per shift, and the speed this has been introduced is proving hard to cope with.
The agency price cap has had a massive impact on our lives. Our income, well, my income, which is a large percentage of our family income, is dropped by 30%. So I'm not really sure how we're going to cope financially this year.
The health regulator NHS Improvement says reining in agency costs could save £160 million this year, and there's already evidence agency nurses are rejoining the full-time workforce. Everyone agrees the bill for temporary staff needs to reduce, but hospitals are clearly struggling with the speed of these cuts, as are the agency nurses who've suddenly seen their earnings plummet. Catherine Jones, 5 News.